health insurance. So most of us, we know, I mean, the way we've seen COVID that has happened, I'm sure most of us know the value of health insurance today, right? So COVID has really increased or expanded the awareness of what it means to have a health insurance policy. Because if I were to look 5 years back, most of us would have a policy that we used to get covered by our employer. That's all. But right now, the entire change in the last 2 years, what we're seeing in the market is, I talk to my colleagues in the industry, and so many online companies and intermediaries. Everywhere there is a sudden spike in the need for health insurance, and insurance companies also understand this, and they have made health insurance so accessible, so easily buyable for their customers. So it's very easy to compare a few products that are there in the market and purchase a health insurance policy. So, but nevertheless, we wanted to go back to some of the basics of health insurance in this webinar for us to understand a few terminologies, a few definitions, and we'll look at it step by step. So, what does health insurance really cover? When you say health insurance, the normal layman language is, something happens to me because of illness, I incur medical expenses, I should be getting insurance cover. Yes, that's the whole thing. But here, when we look at the exact nuances of what the policy offers, it covers both illness as well as accidental medical expenses. But what is important to note is a health insurance cover will give you expenses when you get hospitalized. This is very important. One of the primary requirements for health insurance policy to trigger and for you to get a claim is when you get hospitalized. Now, when you say hospitalized, there's a certain understanding to this. You should be hospitalized for a minimum of 24 hours is the clause or is the condition. So any patient who gets admitted as an inpatient, I'm sure you all understand IP and OP, right? Inpatient, outpatient. So one thing is the time limit, which is 24 hours. Another thing is one should get admitted in the hospital as an inpatient, right? So that is when you expect that there's a real serious health condition which needs attention. And when these two criteria are met, inpatient and 24 hours hospitalization, then the health insurance policy will give coverage. So like I said, the hospitalization can happen due to some accident and injuries, some major accident, minor accident, or simply a fall in the house. Can be any kind of accident, road accident, right? Can be somewhere you were doing a gym exercise and you had a fall. Any kind of accident, it is allowed. And of course, illnesses. When you say diseases like COVID or any other health condition, now we look at some more important sub conditions to diseases, because there are a few which are covered, there are a few which are not covered. But nevertheless, the broad understanding is, due to both accident and illness, if a hospitalization happens and the person gets admitted as an inpatient for minimum 24 hours, then the policy pays the claim. Now, there's a question, right? Now, when you have a health policy, does it cover from day one? Now, we want to now move from the definition of hospitalization, which is 24 hours. There is a waiting period of 30 days in every health policy. Why? See, this is where I said when we cover diseases, we want to make sure that the person was not aware of his ailment when he took the policy. A lot of times, if suddenly people realize that they're going into an illness, and then they feel, oh, it will be too much of expenses, so let me take a policy. So just to avoid this situation where they take a policy knowing that they have an ailment, there is a waiting period of first 30 days. What does waiting period mean? Waiting period, cooling period is something like, in the first 30 days of the policy, we know that every health insurance policy, for that matter, every non-life insurance policy generally is issued for a period of 1 year, 365 days. So if it's given for 12 months, In a health policy, the first month, typically the first 30 days, if the month has 31, we still say 30. So first 30 days, no claim will be payable. This is to ensure that somebody is not going in for a policy knowing that they have an ailment. This is one thing. But again, there is a subclause, there's a sub understanding to this. Accidents are not planned. So if an accident happens, which is totally unexpected, nobody expects to get into an accident. If an accident happens, even on day one or within the 30 days, then the health policy will pay the claim. And then when you talk about diseases, there is something called a waiting period of 1 year and a waiting period of 2 years for a set of ailments. You can look up Google for detailed list of those diseases, but conceptually, again, the 30 days is anyway there, but there are also a few diseases which they have a cooling period of 1 year or 2 years, right? So typically one example is cataract. Cataract is not covered in the first year. Why? Because if a cataract has to come to a stage where a surgery is needed, it has already existed in the person for quite some time. That means, though maybe the person didn't know, but it is more like a pre-existing condition. Before the policy is taken, this person had cataract. Nobody will get cataract today and go for the surgery tomorrow. It develops, it grows. In fact, it has to grow to a certain level for the doctors, only then they recommend to do the surgery. So there are a set of ailments, there are a set of diseases which are clearly not covered in the first year or even in the 2 year period. So these are called first year exclusions, second year exclusions. These days we don't see second year exclusions commonly happening, but first year exclusion definitely is a big exclusion, right? So I have not given you the list of diseases. I've given only an example because different companies have different kind of diseases that are enlisted in this exclusion clause. And then there's another situation which is called pre-existing diseases, which is a typical example can be an ongoing, let's say, like a lifestyle kind of situation. Somebody has BP, somebody has sugar, somebody has a heart issue, right? Somebody has undergone some treatment for a liver condition, or it could be arthritis. So many things which are, it's a lifestyle kind of condition. So it's pre-existing for quite some time, right? And they've been taking treatment on that. Those are anyway not covered under a health insurance policy. The whole idea of whether you call it 30 days or first year exclusion or even the pre-existing disease, the idea is to see that a person does not take a policy knowing well that he has some ailment, right? These are not issues when it comes to accident, but when it comes to disease, yes, these conditions definitely apply under a health insurance policy. So clearly pre-existing disease. Now, how do we know whether it is pre-existing? It's very easy. When somebody gets hospitalized, the history of the ailment, the patient also will know, and the doctor also will be able to easily establish for how long he's been having that problem, right? So it's not difficult to establish whether a condition is pre-existing or not. The moment it is established that the hospitalization is for a pre-existing disease, then the policy does not pay a claim. But however, now of late, many companies are offering pre-existing condition after 4 claim-free years. So if, let's say, even if the pre-existing condition of BP sugar is there, but almost 3 to 4 years, they somehow kind of maintained it, right? Diabetes is there, but still there's no really any hospital condition. That means they've been maintaining it. It can be yoga, it can be medicines, mild treatments or exercise fitness. So if there are no claims generally, then insurance companies do cover it from the 5th year, right? So pre-existing disease, you must observe the policy and check if there is a condition where the insurance company is giving cover for pre-existing after 4 years. Some companies are giving it even after 2nd year. So I'm not giving you the list of 2 and 4 years here, because, like I said, different insurance companies, because of their marketing edge or because of their claims experience, some people are offering pre-existing coverage from year two. Some people are giving coverage for pre-existing disease from after 4 years. So like this, it is available in the market. So depending on your requirement, you can choose, and accordingly the premium varies, and you can take an insurance plan. Here's one ad. If you can see, good news is if you're below 40 years of age, then your pre-existing disease gets covered after 1 year. So they have brought out with their own claims experience. They feel that if somebody is less than 40 years, though they have diabetes, though they have hypertension, they feel they will not have many claims, like an admission situation, hospitalization situation may not arise. So they are covering it after first year itself. That means the policy has run through for 1 year. From the second year itself, pre-existing gets covered, provided the person is less than 40 years of age. Like this, there are many different products that are available in the market when it comes to pre-existing. So right now, so far what we've seen what hospitalization means. 30-day exclusion is there on all policies, irrespective of the company. As far as I know, 30 days exclusion is definitely there in all policies. But the first year and second year exclusion, first year is definitely there for a list of, I think, 7 to 8 diseases. Second year exclusions, many companies have removed from their policies, right? And pre-existing disease, clearly, many companies have different type of conditions. Some are offering from second year, some are offering from the fourth year, and some are saying if you are less than 40 years, after 1 year itself, you can get the cover under the policy. So right now we already saw hospitalization is defined as to get admitted in a hospital for a minimum period of 24 hours. But again, here I want you to distinguish and see there are a few treatments or procedures, because of the sophistication in the treatment, because of the equipments and the kind of medical procedures, they can be treated with less than 24 hours. Typically cataract. So a cataract, which in the, let's say about 10 years ago, you would need to get admitted the previous day, the next day surgery will be done, and then the later in the evening or the next day you would get discharged. But right now you just have to walk in, they do this laser treatment, and then you're out in just in about few hours. So this is against, defeats the clause of 24 hours. So these we call as daycare procedures. So except for daycare procedures or daycare treatments, when you say daycare, they can be treated within the same day. Morning you go, evening you're out. In which case, you don't meet the criteria of 24 hours, isn't it? So when you don't meet the criteria of 24 hours, there is a whole list of daycare procedures that every insurance policy attaches to the policy. Again, this list is different for different companies, right? Nowadays it's getting standardized, but still, if you are yourself you want to buy an insurance policy, you can explore it. You should look at the daycare procedure list. Now when these daycare procedures are listed in the policy, then for those treatments you will get a claim if the hospitalization is less than 24 hours also. So daycare procedures have expanded substantially in recent times. Like I said, because of the sophisticated treatments and the equipments that get imported. So there are many laser surgeries, many laparoscopic surgeries. Surgeries, when even I remember when surgery means minimum 7 days admission, it used to be. I'm talking about 10 years ago. Right now it's less than 24 hours. That is how substantially the technological advancement has happened. So all these surgeries, provided it is listed in the daycare, then you can get a claim under the policy. Now, having seen what is hospitalization, what is daycare, and what are the exclusions as far as pre-existing condition is concerned, we have to see what is there a definition for a hospital? It's very important to know. Yes, it is very important to understand what is the definition of a hospital as per the policy. So the common man's understanding is a hospital is an institution established for inpatient care. Like we already saw, the moment you walk into a hospital, you are issued a IP number. You understand what IP number is? IP number means inpatient number. That means you are admitted into the hospital. You are not outpatient. So OP number means you just come for consultation, you meet and you go. There's no admission. But when we talk about health insurance, it is inpatient care. Now, a hospital is such an institution which is established for inpatient care. So, in that sense, if you have typically a clinic, many these child clinics, you will have pediatricians who will consult. They don't take admissions. They will refer in case there is a situation where there is an admission required. They will write and send you to some other hospital for admission, isn't it? So these are typically, I would say, they are not hospitals. They could be a clinic. There could be a consulting, clinic. So whenever you take a treatment from a clinic where you just go for a consultation, it's not a hospital, you cannot get those expenses as a claim under the health insurance policy. Very important, right? It's very important. You go and spend a lot of money on consultation, you buy medicines, antibiotics are so expensive these days. Viral infection, throat infection, you walk into a clinic, right? It's important the hospital is established for inpatient care. So which hospital you go to is also very important, equally. So another thing is it has to be registered as a hospital with the local authorities. So there's something called Shop and Establishment Act, and there are other regulations. So the institution should be registered as a hospital under the relevant act. And it also maintains certain minimum criteria. It should have qualified doctors and nursing staff round the clock. So why all this? Is this all being checked? Definitely it will be checked. So especially, because I've served both in the public sector and the private sector, whenever we get claims from rural places, most of the times the claims, they are the treatment that is taken from a clinic, it does not qualify as a hospital. And so the claim just gets rejected. So it's very important for us to understand the definition of a hospital, right? Because unless it is registered with the local authority, it has certain qualified system of giving treatment, doctors, nursing staff round the clock, right? They should have that kind of established setup. And most important for a hospital, as per the definition of the policy, is it has at least 10 inpatient beds. So like I said, the problem comes only in case of smaller towns, right? So they may not meet all these criteria, but nevertheless, insurance companies or the so-called TPAs, if you know, most of you, I'm sure you understand what a TPA is, third-party administrator. So they will do the necessary investigations. So there are many times we have denied claims where the particular place where the treatment was taken does not meet with this criteria. So this is a new aspect that you need to understand. So if it is a smaller town, 10 inpatient beds, or it should be at least 15 inpatient beds if it is other than towns, like urban cities or slightly bigger towns, right? And it should have a full-fledged, fully equipped operation theatre. So qualified team of people, number of inpatient beds, and a fully equipped operation theatre. So these are the criteria for us to define a hospital. Now, I want to make this webinar a little interesting. Let's go through some of the COVID situations that we had. Look at this setup, we all have seen this any number of times in the TVs. In the last 2 years, whenever lockdown happened, there was so much rush, the first wave, the second wave. There were so many, educational institutions or hotels, or even in this case, in this photo, if you see a train has been converted into a hospital, isn't it? We also how many initiatives the government took to ensure that whoever had COVID is treated on time. Another thing about COVID we all know is the isolation. People have to be treated separately, isn't it? So the isolation wards was one big thing, and the quarantine is something. So people had to be scattered even to get the treatment. So there was so much need, and so this is a converted ward within a train. Now, is this payable? Now, just now I told you the definition for a hospital. So I wanted to understand with the government giving regulation, when the government announces such initiatives and proper care is taken, like I mentioned in the previous slide, that there is a team of trained professionals to handle it. We saw any number of paramedical staff, right? They didn't even go home. They were there throughout attending to the COVID patients. So these initiatives, which are a little way off from the standard definition, as long as it is taken by the right authorities, the government authorities, then definitely the policy will have to consider and pay the claims. So when all these new innovations were happening, see, look at this, because the oxygen was such a need, the entire train coach has been changed into a ward where there's an oximeter and oxygen tank that was readily kept to treat a patient immediately as they arrive. Now this qualified to be a hospital. Why? Because the government had issued directions to go ahead with such setups. And so, so this is Jeevan Rekha Express. If you see, and this is even before COVID, there is a whole train that offers mobile hospitalization services that the current government has introduced. So in this train, they give treatment for cataract, surgical interventions, plastic surgical corrections, referral services, counseling, right? Because this train is mobile and the health services offered are also mobile. It's most needed in the case of rural and semi-urban areas. So it's a very, very famous initiative of the government. So as long as the government initiative is there and proper care is taken in terms of giving the right kind of treatment, then it constitutes to be a hospital. So training to medical and allied health professionals, voluntary personnel, everything is taken care of, right? And so you expect that the patients will get the best treatment. This is another example where, this is called Lifeline Express. A whole operation theater is set up within the train. So this is again to give mobile services in rural areas. It's a typical operation theater, right? So these are deviations, but definitely because of a government regulation, they can be covered under the policy. Now, okay, so there are pros and there are cons when you talk about railway coaches. So certain things, of course, we need to check when it comes to these kind of adapted hospitals. The important pros, the advantages of such initiatives, definitely the mobility, and especially in case of COVID, the isolation, like I said, quarantine. It was so easy to handle it because they were kept aside in long railway coaches. You could attend to a lot of people. The number of people you could treat was very alarmingly high, and it was a good situation because we needed that at that point in time, right? So scaling up is possible. Toilets are there and their coaches are air conditioned, so you don't have the worry of AC, which is very much needed in case of using these sterile medicines, right? So that way there are a lot of pros, and that's one of the reasons why the government took the initiative. There are a few cons, there are a few disadvantages because again it's important to maintain the hygiene, and it's very, very important because if somebody is already suffering with an infection, it's important to keep the train clean and the air conditions properly serviced because we don't want any further virus or bacterial infection. And also for the medical and paramedical staff, it's important that they are also available to, when you're scaling up so much. There was a situation in the second wave where even the paramedical staff were insufficient. Uh, there were so many patients that we did not have enough doctors to attend to. So, like this, there are pros and cons, but nevertheless, the initiative was a very, very beautiful initiative. Now, so when it is coach, is it covered? Now, here's where I wanted to look at the definition. So, let's see the definition again. So, here's where, if it is as long as registered with local authority, that's why I said government intervention. So, it falls under this. The moment that coach they get registered as a hospital to offer the treatment, then the health insurance policy has to pay. Now, there is also a situation where a lot of people were forced to take treatment from home. Right? So, leave out COVID. There's a very unique situation when you talk about COVID. But what the policy says, we call it as domiciliary hospitalization. So definitely not only getting IP admitted is covered, but there is also domiciliary hospitalization that gets covered, but not like consultation or not like what I said. You go to a clinic and then you take consultation and take the medicines at home. That is not what is called domiciliary. The situation is such that there are no hospital beds and the condition of the patient is such that he cannot be moved out from home for some medical condition. If he's moved, it's very risky for his life. These two conditions, mainly if they exist, then the treatment that you take at home is also covered under a health insurance policy. We don't insist for 24 hours hospitalization in these two cases, but only in these two cases. The first condition is there are no hospital beds available in the city. Full, which is what happened with COVID. There were no beds, isn't it? So in that situation, if you take treatment from home, it can be covered. And the other situation is where the patient is in such a situation, very fragile, he can't be moved, and he has to be treated at home. In that case also, we give the expenses that are incurred at home. This is another picture where you see on the corridor, people are lying on the floor, which is Madrid Hospital. So like this, people took treatment. But all these, because of the government intervention and regulations, got covered under the health insurance policy. Now, can I get a policy for an impending illness? So this is what. So when you say impending illness, it is something pre-existing. Impending in the sense you don't know right now whether you have it, but you're going to get it. You have a sense that you might be getting into some kind of illness. Policy excludes expenses incurred for disease diagnosed within 30 days. This is why 30 days. So impending illness exclusion. Right? So on the day you took your policy, maybe you really didn't know. So I wanted to understand the difference between 30-day and pre-existing. In the case of pre-existing, you know that this disease you have, anyway not covered. But in the case of 30 days, you don't know, it's impending. You also don't know, right? You just one fine day you took a policy, and then let's say unfortunate, after 20 days, somebody, they have a certain health situation, they go and they find that they have 2 blocks in the heart. I'm just saying an example. Right? Or their BP shot up very high and they had to be admitted. Now, if it is the 25th day, though you didn't know when you took a policy, it's an impending illness, still the policy will not cover for the first 30 days. This is something I want to see the difference between pre-existing, where you know that you have the disease, and 30 days where you may not know, but no expenses will be paid for the first 30 days. So this 30 days exclusion also applies to COVID, even the pandemic, right? So even though you didn't know you had symptoms, but simply, you went and took a policy, but you didn't take a test or anything. But if the test you took, let's say the person took within the first 1 month and they were, treated for COVID, does not get paid. There is no coverage for such 30 days exclusion period. So other than the above, there are some first year exclusions and pre-existing, which we already saw. So is hospitalization for COVID covered after 30-day period? Yes. So COVID is covered, right? We all saw that mostly COVID is nobody excluded the cover from health insurance. Although COVID is, the other aspect. I don't know how many of you are familiar with fire insurance and business interruption. A lot of factories also, they went into the lockdown. Their businesses stopped. There, COVID being the reason the claims were not paid because it's not part of the fire policy. But in a health policy, any health expense due to COVID, as long as the treatment was taken after 30 days of the policies are covering COVID as a covered. So just to make it more further clear, IRDA also came up with an explicit circular, right? And they said that wherever hospitalization is required for COVID, the insurance companies have to immediately settle the claims. Only thing, 30 days is a exclusion. So the regulator also came up with, the circular. Now, what if one is quarantined? The quarantine is a part and parcel of the treatment, isn't it? So 14 days quarantine. This is what they say. So 14 days, if somebody has to be in the hospital, do we pay the claim? There's no mention of anything like this. Right? It's a very unique case, first time. So the regulator clarified that the medical policies would pay for the quarantine period too. If you look at the circular that came, the cost of admissible medical expenses during the course of treatment, including treatment during quarantine period. See, because if the hospital has decided that the person needs to be in the hospital under observation for the entire quarantine period because of the basic physiological system of the patient, then the insurance company has to pay the claim. So this is another clear cut guideline that came. So this is now why, if you see, I just want to extend this one slide and say, epidemics were excluded by many companies, but so when you say, now there's a difference between epidemic and pandemic, right? What COVID has been a pandemic disease, but there has been no mention of pandemic being excluded in any of the health insurance policy, barring one insurance company which had epidemic as an exclusion. For your understanding, I'm just saying, which is why, since the epidemic or pandemic was not mentioned in the health insurance as an exclusion, COVID got covered within the standard health policy itself. But apart from this, there was a need that was felt where specific COVID policy also was designed by many insurance companies based on IRDA's request, where the claim can be settled quickly. The coverage is simple, the premium is simple. You have options. You can take from 25,000 to 3 lakhs cover. The premiums are much cheaper. And those who did not have a health insurance policy, it was very easy for them to take a policy only for COVID. That is why we had two policies which were launched with IRDA's guidance. It was more like a standard policy, which means all insurance companies, they came up with standard features. One is Corona Kavach, the other is Corona, Rakshak. Two policies they had come up with. So most of the companies filed their product with IRDA, got the approval, and they they sold the COVID policies. This is the last slide where I want you to understand, one thing is, when you talk about health insurance, majorly only the allopathy treatment is covered, which is what is English medicine, English treatment. But a recent guideline, again, many companies followed the directive of the government where Ayush treatment, right? So Ayush is something that also got extended and inbuilt in every health insurance policy. What does Ayush stand for? Yes, Ayurveda, right? Why is yoga, which again we're not considering for the sake of health insurance? U is Unani treatment, S is Siddha, and H is homeopathy. So if you talk about these alternate treatment methodologies, these are also very much covered under the health insurance policy. This happened even before COVID. Even before COVID happened, Ayush was brought within the treatment or within the definition of hospitalization treatment under health insurance. So in case you get admitted, but again, 24 hospitalization very, very important. So you get admitted and you get Ayurveda treatment or Unani or Siddha or homeopathy, all those expenses also can be covered within the sum insured and within the framework of health insurance. So this is what it is. Ayurveda, Unani, homeopathy, Siddha are also covered. And just to summarize, one more definition about the doctor. Who is a doctor? So again, this is also important. Many people who have medical shops, they prescribe. I don't know. They have an attached, either an RMP, a rural medical practitioner. So it's important that a medical practitioner who has a valid registration code or an approval to practice as a doctor, only when he prescribes, the policy will pay the claim. So there's a clear-cut definition for a medical practitioner or a doctor, which is also mentioned within the policy. It's very important because especially in alternate treatments, anybody and everybody keeps treating. No. So if it is an allopathic doctor, they should have the registration from the medical council of that particular state or in the country, or they should have the council for that particular Indian medicine. If it's Ayurveda, Ayurveda, homeopathy, homeopathy. So there has to be a valid registration for the doctor for them to prescribe and treat the patient. This is also very important as per the conditions of the health insurance policy. So this is a brief webinar which we, every Friday we bring in a few important aspects of some of the products, very introductory level. And today it is health insurance, and it's nice all of you have joined today with us. And we would encourage you to keep a track of all our free webinars. See, our free webinars, walk-in webinars will happen every Friday on some new topic from 5 p.m. to 5:30 p.m. So you can walk in, make use of these webinars, and I hope it was useful for you. In case you want a detailed understanding, you can enroll for the deeper subject courses also. So please visit our website, which is www.iracoaching.com. You will get information of all the webinars and programs that we offer. And in case you found it useful, pass it on to your friends, whichever way you feel they can make use of it.